Hello, good afternoon, everybody, and welcome to the first virtual OAFP Wellness Week. Today's theme is mental wellness and emotional health. I'm Dr. Scott Morris and a proud member and chair of the Joy of Medicine resource team. I'm happy to be here with you guys today. As a physician, you've definitely dedicated your career to caring for your patients' health and well-being. With the onset of the COVID-19 pandemic, patients' healthcare needs have been spiraling, and the hazards of providing that care have definitely intensified. Despite this, you guys have rose to the challenge. While you continue to work on the front lines in a global pandemic, we're now moving to the forefront of a massive vaccination initiative. You've been shouldering an incomprehensible amount of stress and grief. It's more important than ever before for us to be taking care of our own well being, and the OAFP is here to support you. In an effort to support members during this time, the OAFP is leaning into its strategic priority to bring the joy back to family medicine and is providing a full week of wellness by delivering directly to each member. Throughout this week, members will receive daily resources and information on a wellness theme. Hopefully, you received your mental wellness and emotional health one this morning. You can choose how to interact. You can either engage with the content immediately, or you can revisit when you have time and space to do so. Mental wellness and emotional health covers many topics. To provide some of the direction and general information on these topics, we've partnered with the Ohio Physicians Health Program for today's session. We will play a recorded presentation by Nelson Heese, the director of the OHP. A little information about Nelson and his duties. He includes the facilitation and oversight of activities involved in participant monitoring and compliance. He is responsible for processing all the intake calls and coordinating appropriate assessment, treatment, or community referrals, and supervises all daily clinical activities as well as monitoring and advocacy program services. Nelson received his Bachelor's of Science degree in communication from Ohio University. He's a graduate of the Hazleton Graduate School, where he received his master's degree in addiction counseling. He also has a Master's of Science degree in mental health counseling from Capella University. Nelson is a licensed independent chemical dependency counselor, as well as a licensed professional clinical counselor. Following Nelson's presentation, we will hear from Sarah Thompson, the OPHP Outreach and Communications Director, to share more about OPHP and resources available. As you listen along, please feel free to share any questions in the comment section under this video wherever you are watching. Also, please include any comments or your own best practices. We'd love to see them. This is a space to connect and share with each other. With that, let's roll that video.
Hello, I'm Nelson Heese, and I'm the Clinical Director for the Ohio Physicians Health Program. I'm here to just talk to you for probably the next 35, 40 minutes, just a little bit about wellness, especially in the times of uncertainty that we're in right now, dealing with the pandemic, kind of how are we coming out of this pandemic, if we're coming out of this pandemic, things like that, and just talk about ways to do self-care as you're kind of dealing with these struggles. The first part of this presentation, in fact, I'll start moving those slides just so we can talk about the next things. One too many. Just a little bit about me, and I'll then talk about the objectives. I am, like I said, I'm the clinical director for the Ohio Physicians Health Program. If you have no familiar with the Ohio Physicians Health Program, we are the organization that monitors licensees under the State Medical Board in the One Bite program. The One Bite program is the state law that allows licensees under the State Medical Board to seek confidential substance abuse treatment without the board getting involved. So you don't have to worry about getting impairment citations or something like that onto their license. And so we're the organization that monitors that program. So we work with the treatment facilities, and then we do the ongoing monitoring when somebody's completed their treatment. So, we have a pretty extensive relationship with healthcare providers, specifically with physicians and other licensees on the medical board. And I've been there for the last 7 years, serving as the clinical director. So, our goal is to help people get the help they need without having to worry about some of the unfortunate stigmas that exist and trying to seek help for the substance use disorder. A little bit about this presentation that we'll be doing. We're going to just kind of review a little bit about burnout, kind of, what's it look like, what's going on, especially during the pandemic and things like that. What are kind of things that we're seeing, and other wellness concerns. Then we're going to kind of explore some wellness tools, just some things that you can kind of take with you, or some things to consider, or some things that you may know, but just kind of re-challenge yourself into trying to engage into. We'll talk a little bit briefly about some meditation practices, mindfulness, and then finally, we're going to talk about just resources available for physicians when they are wanting to seek help for something, if it's burnout, stress, mental health, substance use, things that they can utilize to get help. So, well, why is it important to talk about these things? I know why is it important for their meditation, but why is it just in general talk about wellness with physicians? Well, one thing is for sure is that the National Institute of Healthcare Management recently, at the end of last year, found that 76% of healthcare workers were feeling exhausted or burnout. So that's everybody. That's including nurses and other healthcare professionals. So that's a high number. That's over 3/4 the people that are taking care of us feeling either exhausted, overwhelmed, and burnt out. And that's a real big concern, because if we don't have you being able to function at top capacity or been at capacity to kind of be able to either handle the stress that comes, especially with the times that we're in, we're all in trouble. And so it's critically important that we are addressing your wellness, and what is it that we need to do to make sure that you're getting the wellness you need, and what are the tools available to get that, and what are some things that have to just change to be able to implement those things. Burnout is defined by 3 things. It's physical exhaustion, depersonalization of work, and lack of efficacy. That kind of, what's the point? Why am I doing this kind of attitude? So if you're experiencing that kind of the physical, I always call it kind of the physical, emotional, and spiritual kind of decay of self, that's really where burnout kicks in. It's like, I wake up, I don't know that I can do this. I don't think I can get there. I feel like I just want to sleep. Emotionally just detached, having trouble caring, having trouble being empathetic, being compassionate, and then that self-questioning of like, why? Is there any point to this? And so those are the things that we're typically, when we're measuring is somebody burnt out or not, those are the 3 things that we're typically looking at. Typically occurs mid-career. I think that kind of makes sense. Early on, you probably have a little bit more stamina to kind of deal with the challenges, a little bit more ambition, excited about moving forward in this career that you've decided to get into. At the end of part of the career, probably looking at the next part of life, what does retirement look like, other things, other transitions that you might be deciding to do with your life, and kind of being able to step away from the, carrying the stress, the day-to-day burden of being a healthcare professional. If you're in the mid-career, you're there. You've kind of gotten past the kind of the pink cloud, and you're not quite at the place where you see the end of the road, and you're in the midst of all this stuff. And as healthcare evolves and as challenges evolve, and then unexpected things like a pandemic evolve, it makes sometimes people questioning, what am I doing? Why am I doing this? Can I handle this? Could I do this for another 15 years? Can I do this for another 20 years? And so that's typically when we see people struggling the most with, is like kind of that mid-career stage, as when they're usually typically struggling with burnout. And obviously burnout causes decreased professionalism, increased medical errors, lower patient compliance satisfaction, which we all know is, sometimes people are only judged by patient satisfaction. And so, patients feeling like they're not being heard or cared for or empathized with, definitely can give bad marks, and that can have a bad reflection and negatively impact you. Then, of course, there's things that are behavioral that are out there that go beyond just what happens in the work environment, things like increased risk for suicide, substance use disorder issues, other mental health issues being activated, and also, just in general, leaving medicine. And I've been working in this field long enough and working with physicians long enough to see that happen. Probably in the last, 2-3 years of just working and having people come and meet with us and do assessments, we've had people that have just decided to step away from medicine because it was just too much, and they just weren't ready to adapt or ready to take on the new challenges that were there, and thought that they could find satisfaction in different ways. So I've seen that happen. I've seen all 3 of things identified here happen related to burnout, and suicide is a huge concern with the physician population. I think the statistic that I had in a big article in the New York Times in the mid 2010s is, it was about 400 physicians commit suicide a year. That's one a day. So that just seems it just seems overwhelming in my mind. The idea that here are these people that, typically are surrounded by resource and other peers and things like that, and feel like they get to a place where they don't have other options. And so that's really, really a challenging thing. And I think part of the reason I would see people being despondent in the physician career is that, statistically, and now this is a little bit older statistic, but in the JAMA article, there was that physicians were twice as likely to be dissatisfied with their work-life balance as the normal, average U.S. adult worker. And so, it doesn't set the drive for wanting to be a physician if you're going to feel like you're going to be dissatisfied and have all these stress, and then, and feel like you're going to be overwhelmed with the demands, which is a concern. I mean, we need people out there helping us. And obviously this impact of this pandemic has been tumultuous or something. And I've heard it through my experience working with physicians through this process. I've heard them a wider range of issues, like from when the pandemic started and when there was the shutdowns where people weren't working because their specialties or things they weren't making appointments for surgeries, et cetera, except for essentials and things like that. So they were, either not working or not working as much or doing other things that they weren't in their wheelhouse to normally do, to then those folks on the other side of the spectrum, they're just being swamped and overwhelmed and can't get any moments to breathe because it's just so impactful, especially given what, area of medicine you might be working in. I know for one thing, we work with, because the respiratory care professionals are under the medical board. I mean, I can tell you almost everyone we meet has just told us the stories of having to deal with this pandemic and how overwhelming it's been for them and their specialty that they do. General reasons why burnout occurs, pretty straightforward stuff. Changing roles and responsibilities, the metric accountability that's put on you, increasing administrative demands, electronic medical records, loss of autonomy, and general sense of loss of purpose, loss of control. And you break those things down, you're just looking at things like, especially things like increasing administrative demands. I know myself, I'm a person that came into my career as wanting to help people, wanted to be a counselor. I was impacted greatly by somebody that helped me in a counseling capacity. And so I wanted to kind of be able to give back in that way. But as I've evolved in my career, and I've been doing it for about 20 years now, and now I'm in an administrative role and doing things that I typically wasn't set out to do. And I'm not doing the thing that I actually was trained to do as much as I used to. And so that can be really confusing and challenging. And you're like learning a whole new career, through the career that you kind of chose to get into. Obviously, the demands, the kind of unrealistic work, situations that people are put into and the hours that they're put into, electronic medical records, and that's always been a common thing that people like or don't like. I mean, the biggest challenge, I think, with the electronic medical records is there was a time, and not that long ago, but they didn't exist, and all of a sudden everything is, and now it's existed. So if I'm a person that came into this world doing it one way, then having that shift and doing it for 10, 15 years one way, then having it shift, that could be a pretty dramatic change and pretty stressful change, especially when you have trouble seeing what is designed to be the convenience or the built-in advantages of having that. And then some systems are just not as user-friendly as other systems. But I think some of the other ones, loss of autonomy. I think there's a one that we'll talk about as we move into the next slide, just kind of the devaluing of healthcare professionals in general. Just like information in general is being kind of devalued. People can go on the internet and find what they want to read, and they become the experts, and they devalue people that have actually done training and had years of expertise in something to then make help make determinations what the diagnosis is, what the treatment is, and people are kind of now becoming junior doctors on their own because they can Dr. Google anything. This one right here is a statistic that I think is even more significant to us in Ohio. This is done by the Ohio Hospital Associations. This is a survey they did a couple years ago. Some of you guys may have taken the survey and trying to see what contributes to burnout with Ohio physicians. And so these are some of the things that they identified, and I think they're very similar to those national statistics, right? Too many bureaucratic tasks, spending too many hours at work, lack of respect, we just talked about that, increasing computerization, so electronic medical records, compensation, lack of control, lack of autonomy, which I think I hear that a lot, feeling a cog in the wheel, lack of respect from patient, regulations, decreasing reimbursement. I mean, right, we talked about this emphasis over profits over patients, which is a little bit of that, like, what's the satisfaction of patient? Are they going to come back to us? Because we need to worry about the business part of it, and not necessarily always what's the best for the patient. And I don't think anybody intentionally thinks that way. I just think that sometimes occurs by the actions that or the messages that kind of get sent, as though we kind of get interpreted, that it feels like sometimes the care that we're providing isn't as significant as, are we going to get more business? So, it's just those kind of things that we're dealing with in the healthcare world that create burnout. So what we're doing in Ohio, or what we experience, and what we see as the reason why people are struggling with burnout, is very similar to what we see in the nationwide. Which physicians are most burnout? I always think this is an interesting thing. And again, this is pretty on track with what it is nationally, but this is from the 2018 Ohio Hospital Association survey. Critical care is the number one burnout. Neurology, family medicine, obviously this population very high. OBGYN, internal medicine, emergency medicine. Yeah, I think the ones that you can kind of identify as why they would be most burnout. And I think, especially you guys, and especially that you guys do, can probably identify why you feel more burnout. I think that there's, especially with family medicine, and it's being such a personal kind of healthcare. I imagine this last year has been full of questions and demands and expectations and confusion, and trying to help the people you take care of. I just know with my own PCP, I can have something that's going on. I'm sitting there, they give me the option at the healthcare facility that I go to be able to email him and ask questions. And it's like, wow, I imagine I'm a big pain in the ass when I have to ask some of these questions, and he's got other, actual patients to see and stuff like that. So, and just in family medicine, we can see some of the reasons why that is, and why particularly in probably this last year, it's even been more so. But also critical care, I think we can understand why that is, especially some of the significant, crises and traumas that those professionals experience. If you're trying to avoid burnout, looks like if you go down to the bottom, like plastic surgery is probably the best way to go about it. Dermatology, pathology, stuff like that. Although who knows about pathology over this last year, that's a change. So, to reduce burnout, it's a two-pronged kind of system. We have to, look at two things. What can the actual healthcare population, the doctors, the nurses, the PAs, whoever it might be, do for themselves to prevent burnout? And then we have, what does the healthcare system do? Now, this presentation is designed for the first one, the physician population. So we're talking about the things, that the resiliency skills that you guys can develop, and we'll talk into some of the personal wellness. But it inevitably cannot solve the issue of burnout, and it cannot create just wellness and solve every doctor, if they just do some counseling and exercise and eat better, they'll that'll take care of burnout. There has to be a change in the kind of the healthcare system, and changes start. Ultimately, I think changes to become big changes have to start with small changes. So we're looking at institutions and organizations to making setting realistic goals and expectations for their employees. Being able to create a better work-life balance, being able to implement tools that actually give people more time with their patients, and then be able to provide healthcare professionals resources for help. Inevitably, you guys are seeing things and dealing with things that are emotionally draining. I've been in this profession. I've heard so many things over the last 20 years that I, as a human being, have to be able to process and be able to, not hold on to, so I can then not feel burdened by some of the traumas that I've heard people experience. So I don't carry that trauma. So that's one of the things that I think we have to make available, is what is the help out there, and what is the support. And we're going to talk a little bit about that. And then there's some things that are common sense stuff, basic wellness stuff, like I was saying earlier, exercising or eating better, sleep, those kind of things. But there are other things that need to be addressed. And I think one of the things that gets minimized, because there's a big stigma in the healthcare professional, is getting help for emotional and mental wellness. That is where we carry most of the burden and most of the challenges. And then where some of our physical ailments come from is being the emotional stress and emotional baggage that we're carrying around. And how do we treat ourselves? So that not only does it make us feel better and emotionally more connected to what we're doing, but it also allows us to physically feel better. So we're going to talk a little bit about that as we move along. So that's where we're moving into. This is my little meditation, image right here, just that kind of serene image of just sitting there being at one with nature and peace and at the waterfall and the tranquility and all this stuff going on right now. And I think ultimately, right, we live in a pretty busy world. We've chosen things and careers that probably don't give us a lot of opportunities to just have these kind of total bliss nirvana kind of moments. But I think the goal is, how can I get, even if I can't have this just a 24/7, being able to be a total, serenity, is how can I get tools to refocus and recenter and create some level of calmness, serenity, being serene during times of midst of stress and crisis. I think that's what we're going to talk about, is getting these tools that we can say, hey, I might not be able to have all these moments where I can just really just zone out from everything, but I definitely can find tools to restart myself, to refocus myself, to gather my emotions and my feelings and stuff like that, and not allow them to dictate into behaviors or actions that I might feel regrettable about. So we're going to talk a little bit about that as we kind of move through the next part of this presentation. So what is self-care? Self-care is creating good work-life balance. That means the things I think we all know, but we certainly don't always do. Making time for family and friends. I think that's so important that we take the time for the people that mean something to us. I think it's a real challenge too, and we get so busy and we're doing so much at work, and then we have things we want to do for our own self-care, and then we get our demands with our families and friends, which we usually typically want to do. And I think what happens a lot of times is we get so overwhelmed by a work situation or being our work life being out of balance that I may dedicate more time, every bit of time I have after that, to my family and friends, and not give myself any of my personal time. Or I get so kind of possessive of the personal time, I have trouble wanting to give it up to other things, and I start isolating more. And it's knowing that I need to be able to have all those things. I need to have a good work-life balance. I need to have good time for myself, and I need to have time with my friends and families and the people that are important to me, so I don't experience isolation. I know I have avenues of support and caring, and again, be able to care back. And so that's really challenging. It's making that time. And I think one of the things I was getting at with that previous point is, if I feel like I'm obligated always to give my family and friends anytime I have extra out of my work, outside of my work life, then I can start being resentful because I don't get the time I need for myself. And I can start getting resentful at work because the work is taking away that time, or the time are making me feel resentful of stuff. And so it's finding that healthy balance. Getting engaged in hobbies, doing the things that make you, if that's writing, if that's playing music, if that's woodworking, whatever it is that helps you create and be give or put into this world. Those kind of important hobbies, the things that help you feel good about something that you're making, you're creating, or engaging in. Exercising, obviously. I mean, we don't have to go into that. This is known. Exercise is critical for wellness. Good healthy exercise too. There's obviously the exercise that's too much when people are become obsessive compulsive about that. But a good regular routine, getting that 5 days a week of exercise in, getting at least 30 to 60 minutes of good exercise in, that will improve your overall wellness. Good nutrition, which is probably something most people struggle with, especially when we're working for 8-10 hours straight, not eating, and then being starving and eating too much and going that back and forth and binging, and we need to be able to eat balanced. I mean, even the 3 meals a day model is kind of outdated, where we should be kind of eating healthy and balanced throughout the day. And obviously the type of foods we eat, the junkier the food, the more it's going to drag us down. It may make us feel good at the moment, much like chemicals can be in that range too. But we all know that then it usually that spike goes down, and then we're feeling lethargic and drained and tired. Working on a spiritual life, that doesn't mean it can be related to a personal faith, but it can also just being connected with what makes you, being connected with your kind of sense of morals and values, and feeling connected in aligning your actions, behaviors, your thoughts with those things that you find to be an important thing about being a productive member of society. And then seeing your own healthcare providers. I can't stress that enough. I can't tell you the number of doctors that come and work with us, sign up for monitoring or doing other kind of support, that don't have their own PCP. That almost is one of the things when we get upset when the general population maybe devalues the service that we bring to that healthcare providers, physicians bring to them. But if we as healthcare providers don't even get our own PCPs, and try to just heal ourselves, we're kind of doing the same thing. So I think it's really important that we get connected with our own kind of healthcare providers and get that outside perspective. Other tools, find a mentor, learn to meditate and do mindfulness exercises. Humor is really good. Good humor, and sarcasm can be good humor. Black humor can be good humor, but probably not all the time. If we do it all the time, then we can be draining, and that could be negative. So it's finding the good balance of that. Nurture self-esteem. Find the self-value, self-worth. Nourish creativity. We talked about that before. Some of the activities you could do to kind of nourish that. Make peace with your past and utilize counseling. This is my spiel when as a counselor. I'm a dually licensed. I think it was on the slide if I didn't introduce that about myself. I'm a master. I have 2 masters in both addictions and mental health counseling, and licensed in both. And I'm a big believer that counseling, just like a PCP, should be used on a regular basis for healthcare checkups. I think people go to counseling when there's crises. Marriage is struggling. We're going to go here and get this fixed. People obviously with substance use dependency, I'm addicted. Help me, how to get out of this. We come when we're in a crisis for something. But ideally, if we were use counseling as a preventative tool, just like we use our regular annual checkups, or when we go to the dentist a couple times a year, or those things that we just do for regular maintenance and prevention, if we put counseling in that spectrum, we'd find ourselves not getting as stressed and burnout, probably feeling more serene, feeling more at peace, feeling more present. Sorry. Oops. I think I skipped ahead. Sorry about that. I think we'd find, more peace, which is our day-to-day functioning. So I really try to press the message that counseling should be looked at as not something as a last-ditch effort. Counseling should be looked at as something like a maintenance and a wellness behavior, like we look at anything else. So, sorry about that. I got my phone was open. So I think we just need to be able to look at, I hopefully kind of get the message put out there that counseling is just as important as a preventative medicine as it is a medicine to kind of treat a healthcare crisis that might be at flaring up, like I say, addiction. But by the time we're seeking counseling, when somebody's got like a substance use addiction, we've missed the boat of being able to prevent that from happening in the first place. And I think that's what our goal is. Maybe we can try to find ways to prevent that, just like when we do screenings for, blood sugars and cholesterol and all those kind of things. So we're trying to prevent the bad thing from happening. How do we implement self-care? Set realistic goals, recognize change is stressful. Every change is stressful because it's going against what you've been doing. That's okay. It doesn't mean it's not working. It means you're just going. That means it probably is working if you're feeling stressed about it, because it means you're doing something different that feels out of sync and out of routine. Understand acceptance, understand control, understand we have minimal control of things. I think that's a hard thing for this population a lot of times, because I think there's a perception we have all kinds of control. And not that we don't make decisions and have to take responsibility for things, but ultimately, we can do what we can do, and we can't control other people. And I think that's the big thing. I think when I share about this message of control is that when we focus on trying to change things that are outside of our control, outside of my own behaviors and actions, I tend to get more stressed and more overwhelmed and more irritated and more angry. If I focus on the things I can do, then I feel more kind of in tune with knowing I've done what I can do, and have, in some ways I have to have some trust and faith in other people I work with to be able to kind of help and pick up with that. And if they don't, be able to learn ways to address that in an effective way so we can make those changes so that does occur, instead of trying to just do it all myself. There's a 90-10 rule about control. And the idea is we control about 10% of the things in our lives and 90% of the things we don't, which is the 10% is usually our behaviors, actions. And I think if I tell everybody, if we had control over that other 90%, think of your significant other, your spouse, your kids, and how much you wish they would do the things you want them to do and they don't do it, and how that drives you crazy because you're trying to control something you can't control. It only causes you stress, so focusing on what I can do is really important. Now, it doesn't mean the things I do don't mean aren't things like set boundaries and stuff like that. Those are things I do, but understanding that I can only go so far with it and understand where my realm is. Don't expect change to be quick. Don't make more changes than necessary. Just kind of take it as they come, make the next step. One of the things that it's pretty, I work obviously in the chemical dependency field, and it's a really interesting field because it is one of those kind of illnesses that the expectation when you go into treatment is that you're going to do a 180 kind of change. all of a sudden, like that you've been drinking alcohol aggressively for the last 10 years and in your life the last 25 years, and all of a sudden tomorrow or today you stop and you never do it again. And not that that's not what we would hope to happen and have people be successful, but we recognize that's a pretty significant life change. And so recognize that, it may not be, I may struggle with that being successful just 100% right off the bat. And I think we know that when we take good care of patients. I mean, think of the diabetic that I'm sure that they don't change their diet and exercise immediately. They may sometimes take slow steps. Now, would it be awesome and great if they just did it all right? And I think, do we not encourage, the most that we can get out of people? We certainly do, but we also have to recognize and empathize that change is sometimes difficult and slow, and then we have to do that for ourselves and be forgiving and say, if I'm making improvements, I'm getting better, that's good, and keep moving that direction. The progress takes time, and that, take baby steps. Every step forward in a new direction is a step closer to getting to where you want to go. I'm working on a doctor right now, and I talk to my advisor says, every assignment you turn in, you're one step closer to your final goal. And that's absolutely right. You just take it one thing at a time, and it does two things. I think it helps piecemeal the bigger goal, and it also makes it feel like everything is an accomplishment. And that kind of is a good internal motivator. Like, this is a step forward. This, I know I'm accomplishing. I've done something to move myself closer to whatever goal it is I'm trying to achieve. We'll talk a little bit about meditation. One thing that's important to talk about with meditation is that there is no wrong or right way to meditate. There are some traditional practices. There are things that people do. It can involve breathing and posture, clearing thoughts, spaces that are quiet. They are all kinds of ways. There are some really traditional methods, but I think any way that we're trying to do things to slow things down, to get into the present, to calm our bodies down, anything that we can get to that is a form of meditation. So I don't know that I think anything that works effectively for you to be able to meditate is a good thing. Could it be through doing those smaller things that you find a way to become more in tune with a more traditional sense and give more time? Sure, I think that ultimately would be the goal. But I think we're just trying to find time to start making small implementations that would move you towards wellness. And the essence of meditation is just to focus on your attention, to get rid of the mind clutter, just to get all the junk, move it aside, and just be present in the now. I have one video on here that I'll show, but I don't have the other one on there. It's a video. This guy's named Andy P. I can't think of his last name, but there's a TED talk on it. Talks about meditation. I've seen him do some other talks as well. But one of the things he cites a study, and I'm going to get misquoted on this. I don't know if it was Harvard or Johns Hopkins or somebody did a study where they're talking about being present. How much we don't spend our mind in the present. It was something like 56% or something like that is we spend being not in the present. They were focused on something on the past or something that's coming ahead of us. So that means less than 50% of the time that we are present in the now. And I thought about that, and it was really impactful because I think, I do worry about things, or I do try to plan ahead. I mean, part of planning ahead is trying to control things. I'm not only am I planning ahead, but I'm also trying to plan the outcome of the thing ahead. And I recognize I'm missing the moment now. I mean, I don't know if for you guys, but I've been at my kids' sporting events and been on my phone doing something instead of watching the game, instead of being there for the thing I'm there for. And I really have to challenge myself a lot to be more present. And that was really helpful. Nobody gets to a place where they're 100% present all the time, but I like to turn that number around. I like to think that maybe I could be more present 56% of the time instead of 46% of the time, or I could be present 60% of the time, or, something like where I'm actually engaged with the now more and being more involved with the things I'm doing. I think that not only does it make me feel, more connected to the people I am, but I also think I know personal experience, and we also have statistics out there that will tell us that it reduces stress, lowers blood pressure, helps reduce headaches, it gets better sleep. Just things that are critical for wellness. Meditation practices, most important thing about meditation is just do it regularly. Try to implement some sort of thing into your life. The ideal meditation time is that we hear is about 20 minutes, if we can do that. But I'm going to go back to, if I spend 5 minutes a day doing it, and that's something I wasn't doing before. If I spend 2 minutes that I never did before, now I'm trying it, it's a step in the right direction. And in fact, we'll probably, if I'm finding benefits in that 2 minutes, I'll probably encourage myself to get to 3 minutes, get to 4 minutes. It's just like when I tell people, and some of you guys probably remember the healthcare initiative of get off the couch for 10 minutes 3 times a day. Well, getting off the couch for 10 minutes is probably not a ton of things that's going to do for you. But the goal was, and the message was, start doing something. Start small. Start some goal. If I start getting off the couch for 10 minutes, maybe I'll get off the couch for 20 minutes. If I get off, maybe I'll make it 30 minutes. Maybe I'll do it a couple of times. It's the idea is doing something that might help motivate me to do something more and more frequently, and get the actual maximum benefit out of the exercise. And don't forget, the important thing to do about this, if you do implement some sort of meditation, mindfulness kind of into your world, is do it for the sake of doing it. Don't do it for the idea that it's all going to make my life better and going to fix all my problems. It's not what it's going to do. What it's trying to do is going to help you become more centered, more calm, and more relaxed, to be able to hopefully make better decisions or more concrete decisions, or at least be at more peace with things and less stressed out when you're trying to make decisions. Life is still going to be life. Life is going to throw you curveballs. Life is going to be difficult, but this is going to help you to be able not to get so overwhelmed by that life. And don't try to force the results. I mean, they will come. Things will come. If you have children and you're trying to help them become better at something, and I had it where my kids feel defeated because they aren't hitting the ball the way they want to hit it right off the bat, or they aren't playing the way they want to in soccer, the way they want to. It comes with time. Let's keep practicing. Let's keep practicing. I know I've had that success with my daughter, being able to have her be able to get better and better at the things we do. We play ping pong, and I remember the first time I would just beat the snot out of her, and now it's a competition every time. And it's just, I mean, I had it at the table maybe a year and a half now, COVID purchase, and gotten really good. And I remember the feet feeling that she had at the beginning to where she's at now, knowing, I mean, she's beat me a few times where it's like that, like I've gotten somewhere with this. So, it's the idea of just kind of moving and recognizing it's not going to happen at once. Just take time and just keep practicing. I'm going to show a quick video, and then we'll kind of hopefully get closer to wrapping some things up, and we'll go from there.
You may have heard this word mindfulness. It's become something of a buzz phrase of late. I'm going to give you one simple, serviceable definition, which is this. Mindfulness is the ability to know what's happening in your head at any given moment without getting carried away by it. Imagine how useful this could be. Just as an example, you're driving down the road and somebody cuts you off in traffic. How do you normally react? I think most of us, we normally react by having a thought, which is, I'm pissed. And then what happens next? You immediately, habitually, reflexively inhabit that thought. You actually become pissed. There's no buffer between the stimulus and your reaction. With just a little bit of mindfulness, in that same situation, you might notice my chest is buzzing, my ears are turning red, I'm having a starburst of self-righteous thoughts, I'm getting angry. But you don't necessarily have to act on it and chase that person down the road, screaming at them with your kids in the back of the car thinking you've gone nuts. Now, you might be thinking, don't I need to get angry sometimes? Aren't I justified? I would say yes, but probably not as much as you think. The proposition here is not that you should be rendered by mindfulness into some lifeless, non-judgmental blob. The proposition is that you should learn how to respond wisely to things that happen to you, rather than just reacting blindly. And that, my friends, is a superpower. How do you get it? The way to get it is through meditation. I believe that meditation and mindfulness are the next big public health revolution. In the 1940s, if you told somebody you were going running, they would have said, who's chasing you? But then what happened next? The scientists swooped in, they showed that physical exercise is really good for you, and now all of us do it, and if we don't, we feel guilty about it. And that's where I think we're headed with mindfulness and meditation. It's going to join the pantheon of no-brainers like brushing your teeth, eating well, and taking the meds your doctor prescribed for you. Let me just close by saying, mindfulness is not going to solve all of your problems. It's not going to render your life a nonstop parade of unicorns and rainbows. Nonetheless, this is a superpower, and one that is accessible by you immediately.
So hopefully that was a fun little video, just kind of talking about the benefits and why becoming mindful and practicing meditation is really important. Again, not solving all the problems, being able to, as they said in the video, respond wisely to things differently than just the emotion and letting that dictate my behaviors and actions. I know when I let my emotions, because my emotions are fleeting, I have tons of them a day, but when I let that emotion become the permanent feeling at that moment and how everything's going to always be, and let it then dictate my actions, I usually do stuff that I'm not really happy about. And I might have to make an apology, I might have to make an amends, or feel something regretful. And so I know that what meditation and mindfulness can bring is the ability to slow down, stop, process, acknowledge the emotion, know that it's there, that it's valid, it's telling me something, but then what is the response I want to have from that, and not allow just the emotion to dictate the response, but me to get in control of my behaviors and my actions, and not my emotions, because my emotions are fleeting. I have literally, and I most of you have been very happy, in 1 second something happens and I'm very sad. We can change on a dime. And sometimes the thing that makes that, or turn it, or get very angry at us, is something small, but I'm in a spot where that triggered something and I have a response. So I know I can't rely on my emotions to dictate all my actions, because they're not reliable. Here's some types of meditations you can try. There's walking meditation, guided meditation, where you have somebody kind of talking to you about, feel, now just feel your fingertips, or, your toes and stuff like that, just kind of guides you through something. There's mantras or sayings and phrases to repeat. Breathing exercises are pretty common. Meditation into the nose, out through the mouth, doing it into like 5-second cycles. Empty mind meditation, and practice of trying to find ways to clear the mind. Also, not beating yourself up if you can't clear the mind, but just if a thought comes in, helping it move it away. And then just, as we talked about, just mindfulness exercises. There's apps and things like that you can get to kind of help with kind of guiding you into kind of what some mindful exercises would be. And I'll do a few on this at the end of this presentation. I always like this image, right? I think it says it all. If my mind is full, it looks like the picture of the adults, cluttered, mess, overwhelmed. And I get to the kid picture and they're being mindful, and all they see is the field in front of them. Right. You cannot live always in the field in front of us, but I would like to be able to have the tools to live there more often than I do. And I think that's the kind of idea what we're saying here, is being able to be at peace and be in the moment more often than we do right now, and not getting overwhelmed and not being so stressed that at times when we should be enjoying and appreciating life, that we're still stuck in the bubble that has all this stuff going on. Getting started exercises, there's a few things you can try to do. These are just some things that kind of can take with you. Mindful listening, right? Listen to a type of music you haven't normally listened to. You like pop music, put on a jazz record. You like jazz, put on a country record. Just do something you've never experienced before and see what it makes you feel. Just be with it. Don't judge it. Don't give it things. Just something to just be with it and let it just have the experience. It's something that you've never known, you haven't heard of, and let it kind of let you just experience what you're feeling and be present with it. Mindful awareness, do something you do every day, like open the door. For me, like log into your computer, and take that minute or two, have it a touch point, stop for a minute, two, notice where you're at, what you're feeling, try to regroup, for me, it's always good when I go log in at work, is I check in. I'm usually pretty busy because I had to get the kids to school and whatever, everything's got to happen, rush to get here, well, traffic's not as bad anymore, but it used to be going against the traffic. I'm pretty overwhelmed. Taking that minute or two just to collect where my feelings is really good, because then maybe I don't bring some of that stress out into my coworkers or the people I'm working with as clients, and it's time to just reconnect. Mindful immersion, take a everyday routine and, instead of like rushing through it, take the time to appreciate the exercise, maybe appreciate and do the exercise differently. That's the one, hey, take time and brush your teeth with the opposite hand, just see what that's like, just like re-experience something, just being able to take something and re-immerse yourself into it in a different way, instead of just doing the day-to-day task and being rushed and overwhelmed by it. Gratitude list, that's what the next one is, mindful appreciation. Notice 5 things you appreciate during the day and write them down, and then you can explore them later, what they meant, what does that mean to you. You can kind of think about something you've not thought about before, and just explore something, and kind of a little bit of like going down the rabbit hole and just letting your mind wander somewhere without the stress of like having an objective and a goal and whatnot, and just being present with something that you've learned to appreciate. Doing mindful loving kindness, This is kind of a little bit of the mantra, saying a happy, positive phrase to yourself over and over again. You say something enough, or you can say it to somebody else. If you're having struggles with some resentment towards somebody else, you start letting that statement starts becoming a real thing to you, and it helps kind of turn those emotions around. And then it says mindfully eat a raisin. Although most of the time I've ever done this exercise is with the Hershey Kiss, where you take something and you eat the thing slowly, sense it, savor it, and just be present with it instead of just rushing and gulping it down like a lot of times we do, and just kind of be purposeful with it and be able to appreciate something more so. I can tell you when I have my kids eating, that's what it feels like, that they're purposeful with everything because everything is very slow and they eat it, which is probably good for me. So here's some physician resources. Right, we are available. Just a little bit more about us. We do work with people with burnout and mental health things. I mean, it usually stuff that is usually pretty moderate things that can be handled internally. We do some preliminary assessments to kind of help people know what they're dealing with, kind of create, if they need external referrals, give them the external referrals, do some internal stuff. We do have a coaching and counseling staff that does help with some direct services that we do. And we do have behavioral health contracts and stuff like that with people that may need some support and guidance to get implemented and connected with moving forward, and do advocacy with people. We've helped physicians get reestablished with their work environments or make the next steps in their work environments by helping with the coaching, counseling, and advocacy. There's the High Physician Wellness Coalition, which OAFP and OPHP and other most of the medical associations in Ohio are part of. It's a High Physician Wellness Coalition. You can go there. The website's on this at highphysicianswellness.org. There are free wellness CMEs that you can utilize to talk about things like burnout, stress, gratitude, vulnerability, a variety of different things that are on there. They're all free. There's also some other resources there that could be helpful. So there's a couple things that you can utilize. Obviously, one of the things we just say is there's a lot of local and community stuff. We can help you if you're looking for that, finding ways to get connected with that. But I think, as I reiterated earlier, counseling is very important. So getting counseling or getting some support outside of family and friends, because we need sometimes that outside perspective that doesn't have that emotional baggage that they're carrying with us that might skew perspective. I think that's a critical piece towards wellness and some of the other things. I'm not a nutritionist. I'm not a gym instructor, so I'm not going to tell you how to be a fitness instructor. I'm not going to tell you how to do those things. I'm just trying to tell you those things do work and they are part of wellness. And those are probably safe for professionals. I can tell you specifically what are the benefits and how to get started on that. I've set questions, of course. This is just, I do have one of my coworkers is here. I could not be at this live at this presentation because I'm actually doing some self-wellness with myself. I'm with my kids, probably currently as I'm talking to you on this, riding rides at Hershey Park. We've never been there before, but we wanted to go to the rides and go to Hershey Land and see what that's about and enjoy ourselves there. So I'm doing that. So one of my coworkers will be answering probably more questions just in general about OPHP and services we do, but I did think one of our clinical staffs with us that can talk a little bit more about wellness. And this is my contact information. So feel free, if there's anybody does have any more questions or services about what we do, to reach out. You can send me an email, you can do a phone call, you can go to our website and kind of find the information out there. Anyhow, thank you so much for giving me your time. I appreciate being able to do this, and look forward to seeing you later. Bye.
Wow, that was a ton of really great, valuable information that he just shared. If anyone has questions or comments, please put those comments under the video wherever you are watching this. And I'm going to turn it over to Sarah to help provide a hello from the OPHP and share what resources are available.
Yeah, awesome. Can you hear me all right?
Yeah.
Awesome. Well, thanks for having us. I think Nelson pretty much covered it in his talk about what resources we have available. But Caitlin has so kindly put some links that Nelson did mention in the chat box for you all. We do have a plethora of self-assessments on our website, ranging from a stress assessment to a burnout assessment, a depression screening. Those are all great tools that we have accessible on our website. As well as he did mention the Ohio Physicians Wellness Coalition that OAFP is also a part of. Over the past couple years, we have put out several different videos. I think we're up to 11 CME credit hours now on videos about wellness and meditation and mindfulness and vulnerability and the benefits of therapeutic counseling. And so I will go ahead and put that as well in the chat box for you all as well to access those videos. And you also get some free CME out of it, which is always great. Oh, look at that. It's right on the screen for you. And we've got several people on there, lots of our staff internally, but also some other folks that have so kindly agreed to help us with these videos. So please check those out. I also wanted to mention, in Nelson's presentation, he did talk about some statistics, and I'm sure all of you are being bombarded with surveys right now about the impact of COVID-19 over the last year and some change. And so we actually also have a survey out right now where we're just surveying Ohio healthcare professionals. So we did a big literature review before launching this survey, and we recognized that a lot of the surveys that exist are profession specific. So they're just to physicians, or they're just to nurses, or they're just to counselors. And so we're actually surveying all healthcare professionals just in Ohio. So we'll have very, very good data, just Ohio specific, that we can compare, what the data is saying about physicians versus nurses versus speech therapists. And the intent behind the survey is really to create solutions for the future, to put infrastructure in place, to put legislation in place to prevent burnout, to prevent stress, to prevent all of the things that you are all experiencing. And so please, if the survey is in the chat box, if you haven't taken it yet, please do. We're up to about 10,000 responses so far from all licensees. So we're not really where we want to be in terms of our goal, but please go ahead and take that as well to better give us information on how we can provide services to you all in the future. So, like Nelson said in his presentation, we've got a full clinical staff here. We have a medical director who is a board addictionologist, board certified addictionologist. We have multiple master's levels counselors on staff, as well as the licensed chemical dependency counselors. Anything related to wellness, stress, burnout, depression, anxiety, our staff is fully, equipped to handle. Just give us a call, and we have so many resources on our website, and we're really able to help people navigate the system, which is sometimes the hardest part when you've got a professional license of kind of where can you go. And I think Nelson mentioned it in his presentation, that third party outside perspective is so important. I don't want to go to, my therapist, Nelson. I want to go to a person outside of my office to talk to and stuff like that. So reach out. I'll put our contact information as well in the chat box. And we're always here to help anybody. And we're a great staff. I might be biased, but great staff of really, really caring people. So if you need anything, please feel free to reach out.
Yeah. So kind of an interesting question kind of off of that, Sarah. So I know you thought about kind of self-referral and how to refer ourselves. What if we have a colleague that's we feel like is really struggling, and we want them to kind of be able to reach out to you guys as well? We may have kind of had a conversation directly with them, but still not seen any progress. How would we set somebody else up with you guys?
Yeah, so I think feel free to just give us a call. As physicians, there is that duty to report requirement that y'all have, and all of that. We luckily have had a very great relationship with the medical board over the past several years to create some confidential programs for folks to seek help. Give us a call, and each situation is going to look different and is going to be different. And having an outside party like OPHP being able to handle something like that really allows for personalized approach to each individual person. And so if you're that practitioner who is concerned about a colleague, give us a call and we can help you walk through that potential, what that could look like for getting intervened with that individual and helping them.
Nice. And then kind of other kind of fun question that just popped into my head.
Yeah.
We talked a lot about mindfulness and different meditation styles and those sorts of things. I know we had thrown in a couple links, and then it looks like a podcast as well. Are there any apps or kind of easy trackers or tools kind of out there for us to kind of dabble into and try out?
Yeah, I saw, I think it's Dr. Sevilla had made a comment that he loves Dan Harris. I am a huge Dan Harris fan as well. So Dan Harris, for those that don't know, is one of the anchors on ABC News for Good Morning America on the weekends, and he's hysterical. But he came out with a book called 10% Happier, as well as an app, meditation app, that they have meditation teachers from all over all over the world being able to walk you through that. Calm is an app that the staff here at OPHP actually use as well. Many of us do. It's a great, tons of different types of meditation, like Nelson talked about, the walking meditations or the guided meditations, or just ambient noises in the background as well. So those are two. Headspace is another great one in terms of meditation and mindfulness. And actually, this is a pretty popular topic right now. I think this is a lot of people are getting engaged in this. Netflix has some great documentaries as well on mindfulness and meditation. I actually, a couple months ago, just started listening to them, and they are meant to help you fall asleep at night. And so you can turn it on in the background, and it's a great way to kind of unwind and get ready for bed at the end of the evening.
Well, great. Well, Sarah, thank you so much for kind of sharing all this information about OPHP, and please extend Nelson as well for providing so much valuable information.
Yeah.
I know there was a lot for us to digest in there, but just having this resource to reference will definitely be very helpful. I'd like to throw a thank you out to our live viewers for listening in, and anyone else that wasn't able to join in live. This session is recorded and will be shared on the Wellness Week webpage, as well as the OAFP Facebook and YouTube pages. Finally, a quick reminder about the remainder of the week. Make sure to take part in the Wellness Week Challenge to focus on physical activities and gratitude every day. If you submit your Wellness Week tracker by August 20th, you'll have a chance of winning the OAFP logo item. More info in your daily emails. If you're craving some additional family medicine, family physician peer time, join us at the virtual family medicine party hosted by the OAFP Foundation this Friday at 7 p.m. We're recognizing the philanthropist of the year as well as the mentor of the year by adding some friendly competition again with trivia. Registration is required but completely free to attend. And lastly, tomorrow's theme is finding and renewing your why. We will have another live chat at 3 o'clock with Kim Yu on discussing building community connection and how there's joy in that. Make sure to catch it live here on Facebook and YouTube. Otherwise, make sure you enjoy the rest of your Tuesday. Stay well, be well, and remember, you guys are not alone. We are here for you.